Center at the West Seattle, as well as the West Seattle Chamber and the Northwest LGBT Senior Care Providers Network. We're here tonight to ask you to fund our proposal to develop, implement, and evaluate an evidence-based cultural capacity training program for aging and health and human services for professionals, addressing the unique risks, challenges, and strengths of the LGBT, older adults, families, and caregivers. LGBT adults have unique needs, and by understanding the distinct factors that characterize the needs, we can move forward in changing public policy and programs to better serve these communities. Many LGBT older adults came of age during an era when same-sex behavior and gender variance were severely stigmatized and in some cases criminalized. They often have internalized their own society's negative attitudes, beliefs, and stereotypes. Being victimized because of one's actual or perceived sexual orientation or gender identity is different in some ways than other crimes, since it is an assault on who one is. Lifetime experiences of victimization and discrimination have been linked to increased risks of poor general health, disabilities, depression, and many other factors among LGBTQ adults. LGBTQ older adult participants in our report high rates of victimization and discrimination over their lifetimes and biases in their everyday lives. This continues today by refusal of service at many organizations and communities by untrained staff. We know that most aging and health and human services providers do not have adequate training to effectively serve the LGBT older adults. It is critical that we provide cultural competency trainings that address such unique challenges, such as victimization and discrimination, that LGBTQ older adults face in order to better address their health care needs.
Good evening. My name is Allison Aldridge. I am the Director of Community Engagement for Pride Foundation, a regional community foundation that funds LGBTQ leaders and organizations across the Northwest. And previously I worked at SAGE, which is Services and Advocacy for GLBT Elders in New York City, where there are multiple city-funded programs for LGBT older adults, including the only city-funded LGBT senior center in the country. So I am acutely aware of the unique challenges facing LGBTQ elders and the ways that these policies can improve their quality of life. LGBT older adults make up a significant and growing share of both the overall LGBT population and the broader 65-plus population. LGBTQ older adults now represent about 2.4% of Seattle's elder population, and as the population of all older adults, the number of local LGBTQ elders will double in size over the next several decades, yet there are no city-funded programs in Seattle to help support this marginalized group of elders. We know that the LGBTQ community is a vital part of Seattle's life and culture, yet these older adults are more at risk for social isolation, economic and health disparities, and abuse than their heterosexual counterparts. We know that LGBTQ older adults locally are more likely to be single and to live alone, without children, and estranged by their homophobic family members. And in fact, almost 45% of LGBTQ older adult participants in the Aging with Pride report, they live alone and they are at serious risk of social isolation, which is linked to poor health and premature mortality. Living in isolation and fearful of the discrimination they encounter in mainstream aging settings, many of LGBTQ older adults are at risk for elder abuse. I want to give you some time. Thank you for your consideration.
My name is Shilpan Patel. I'm an oncologist actually at the Hutch and the Seattle Cancer Care Alliance, and I also chair the National LGBTQ Task Force. I'm board chair of that. I can tell you as a healthcare provider, there are inadequate, if any, resources that exist, and there is no program like this where healthcare providers can go to kind of learn to be able to treat our patients better. And so I implore you guys to consider helping with this need. It's clearly there's tens of thousands of people out there that need this, and unfortunately nationally and locally nothing like this exists. Thank you.
Thank you. the